Hello, hello, and thank you so much for joining me today. Today, well, let's start. This week, July 29th, is my birthday, and it's my baby's birthday. Okay, so Jayla's turning 1, and I am so excited to have a 1-year old. Also, completely mourning the fact that I no longer have a baby, and well, she'll always be my baby, but I no longer have um, like those newborn days or those really infant days. She is 12 months and, wearing 12 months clothes, and she is a toddler essentially. So we share a birthday if you didn't know. And I am going to share a little bit of my birth story today. I have never fully released all the details of my birth story. You can listen in on the podcast, and I go through a ton of how I manifested my birth. I think there's actually an episode where I shared my exact birth manifestation for Jayla. And unfortunately, like all good birth stories and plans, it didn't go to plan. Some really good stuff happened. All the pelvic floor stuff was amazing. And I can't be more grateful for that. And I will share all of those details. But as far as like my actual birth manifestation, it was pretty much horseshit, and nothing that I wanted to happen happened. So that's okay. And I shouldn't say nothing. Some of the stuff was really good. I had this whole year I spent processing before I fully dove in to share this story. And so when I came to share this story today, I come from a different place where I was a year ago, but I'm still healing my own birth from Jayla. And, she's my third born. She's my third birth. She was supposed to be a home birth. And I had an amazing midwife and a doula. And I had a magical birth planned with twinkle lights in a tub in my room, laboring in my garden, having this amazing, magical, Instagram worthy water birth. In fact, I even almost wanted to film it and, wanted that piece filmed. And none of that happened. None of that happened. It all went to shit. But some really good things happened. And I truly believe that the universe gave me my experience. God gave me my experience to help me learn. And honestly, that's my mindset as I move through my life is win or learn. And you don't always, things might not turn out exactly how you planned or had wanted, but you get an opportunity to see those experiences how you want to see them. So you can choose to see them in a positive light, and you can choose to learn from those experiences. And that is a gift. That ability to learn from those losses, if you will, is a complete gift. And I don't take that for granted. So I've come a long way this birth, but at the same time, healing from this birth. But at the same time, it doesn't make it easier to reflect. And there's been many times this year that I have replayed this birth. And, after her birth, it was probably the most trauma I've ever experienced as far as like mental trauma from any of my births was really her birth. And I think it's because I had put so much expectation on myself for wanting this certain type of birth. And so, yeah, so I want to share it. We're going to dive into that today. And yeah, I'm excited to see where this goes and see what questions pop up for you guys um, as we go through here. So let me just make sure this is still recording. And okay, so we are live, and it should be good. Everything should be good here. So, one of the things about Jayla turning 1 is that I'm like completely mourning those early newborn cuddles, and like, even where she is now, it's like there's this part of me that's like content, and then part of me that's like sad that she's getting older, and then part of me that's super excited to see her get older and like see her establish herself. And all of it is amazing. And it's what I love the most about my job is I get to be around amazing women who experience this type of life that I do, and sometimes have walked the path a lot, um, you know, have walked the path before me and can give me these amazing words of advice that it's okay to mourn your infant years and your kids' birthdays essentially because they're getting older, but you get to enjoy the new moments too, and all of that is okay. So, so I'm grateful for that. But okay, so as far as my birth story is concerned, so I want to bring you back because I've been bringing myself back all week long because essentially, what is today? Today is July 27th. My due date last year was July 26th, 2022. It was a Monday to my knowledge, but I don't quote me on that one. And I delivered Jayla on Thursday, July 29th, 2022. And so my water actually broke on the night of the 27th, and or sorry, the early morning. So the water broke at 2:37 in the morning. You felt the pressure, the pop, all that stuff. And I was like initially excited and then go to the bathroom. And what do I see? Other than some, brown tinted amniotic fluid. And if you know what I'm talking about, um, you don't want amniotic fluid to have any color in it, right? It should be colorless. You should almost not be able to tell if it's like urine or water or what. Like, a lot of people will be like, did I just pee myself or did my water break? And, but if it's tinged like brown or tan, you know that your water broke and you have meconium in it. Well, with my midwife, and I believe this is midwives in general, but I could be misspoken. I don't know the Washington state law or if this is a law around it, but she is not comfortable. She was not comfortable delivering a baby who had meconium in the amniotic fluid. And, if it happened like right during the labor process, it would be a different story. But the fact that it would happen before I was even in labor, or right in the birth process, she would have been okay with it. But because it happened and I wasn't actually in labor, that means for her, it's an automatic transfer to a hospital. So my water broke. And before I even texted her, I knew that I would be having to transfer, and it was devastation. Straight tears, crying, shaking, just like I couldn't believe it. I was so upset. I had manifested this magical home birth, and nope, we get a hospital birth again. And it's probably not going to be Northwest because Northwest doesn't take transfers essentially because they're always so busy. And my other two babies were born in Northwest, and I love Northwest Hospital, so I wanted it to be there. I pretty much know the horror stories of every single other hospital in the area. And, because I hear everybody's birth stories. And so I was like, where else can I go? And Virginia Mason had just opened their birth center it was like a year old. And I had had some patients have amazing experiences there. And so I opted to be transferred there. So that was, long story short, that was kind of a fast forward. But back to when my water broke, I, texted my midwife a picture of the color, and she was like, yep, that's definitely meconium. We're going to have to transfer, but let's touch base in the morning. I'll come to your house and we can kind of like see where things are at. And so I'm like, okay, like we'll just do that. My doula came over around like 9, I think 9 or 11 sometime. Time all runs together, especially a year after looking at this. And so they come over to my house, and we actually have like the most lovely day of trying to get me into active labor. And, we sat in the garden. I pumped. I did these herb tinctures, which I actually completely forgot about until I went back and looked at my notes for right after birth. And if you read the blog that's associated with this YouTube, you will also see like some of the quotes I shared from those early writings that I did right after this birth. And they're not pretty, and I don't even know if I should share them. But at the end of the day, I'm sharing this because I want to help other people. I want people to know, like, yeah, my birth didn't go as planned either. And it's okay to have trauma around what happened and what you didn't want to have happen and what you wanted to have happen but didn't happen. So it's all okay. And we all just have to process it. And it's how we do that and move forward, essentially, that matters. So that's why I'm sharing this with you today. So back to back to where I'm laboring at home in the garden. That was actually, like, reflectively looking back at it, it was pretty magical. I got to go on 2 walks that day. I did a ton of movement. We did a lot of spinning babies, and I guess I was, like, actively, really hard working to try and put myself in labor and, pumping and doing the herbs. So then we, um, get to about 5 o'clock. Or, sometime late in the afternoon. I am 5 centimeters dilated, and the baby's pretty low, my midwife said. So she's like, you need to go, like, we need to transfer you now, else I'm worried that things are going to progress too rapidly at home. So transferred to Virginia Mason. She actually came with me, which was so sweet. And so did my doula. And, in the time of COVID, they both couldn't come up to the room with me. So it was just like I had to just go with my doula and say goodbye to the midwife at the intake desk. But like the fact that she even drove down there and like, gave them my whole history and introduced herself and kind of gave the whole process. It was just like, it was so beautiful. It was kind of like this amazing care that you don't expect to get. Also, the fact that she just like helped me labor at home and kind of kept me home as long as she felt comfortable and safe. It was awesome because like I kind of got to do my own thing now. And so I'm really grateful for that. And I really am grateful for the midwifery care that I had with her because I just felt so empowered, and yeah, so safe the whole time. I actually, like felt safe enough that I'm like, I can have a meconium baby here. Yeah, just call the paramedics and, have them be here when I deliver in case the baby has aspirated the meconium. Um, and I don't care. Like, we're good. But, at the end of the day, I told my husband that, as far as like negotiating having a home birth, I said I would listen to medical advice. And so her medical advice was to transfer to a hospital. And so I did. And so there I was at Virginia Mason laboring. Um, the issue was that like I just wasn't progressing very fast at all. The one lovely thing that the midwife did is the midwife and my doula, they snuck me some castor oil in the hospital. So we had castor oil and they put it in a milkshake and it was absolutely delicious. I think the kids had like an old like Oreo McFlurry in the freezer. And so they're like, what ice cream do you have? And I, I think they were like, they blended it with one of the kids' old Oreo McFlurries because my kids always only have like 2 bites and then put in the freezer when they get those. And so we snuck that in a water bottle into the hospital. And when things just weren't progressing much at the hospital, and I actually regressed in the baby in Jayla's descent, like she wasn't as deep in my pelvis anymore. And part of that is like the stress of having to like actually go to the hospital, right? And then having to actually like drive down there, be in rush hour, be stressed about getting to the hospital and then like but still keep your body in this parasympathetic state. Like, yeah, that's just impossible essentially. So of course my pelvis and pelvic floor were like, we're gonna tighten back up and not like let the baby come out now. So all that's going on. As much as I tried to stay relaxed and tried to keep breathing the whole process, it's so hard to override those stress responses. So, laboring at Virginia Mason was lovely. The tub was very small, and so I didn't fit in it. I was very large at the end of my last pregnancy, and there was definitely no way I could comfortably lay in the tub. And so I didn't get to use the tub, and that had always been like my best laboring experiences and like where I can tolerate the most. And yeah, so I didn't get that, but I did get to do other things and move other ways. Um, Kind of once midnight rolled around, right? Like I'm getting close to that 24-hour mark of in labor with my membranes ruptured, and you know, that's when people are like, okay, things better be moving along. You better be making progress. And I felt a lot of progress. I knew my labor was really ramping up, but my cervix was not showing it. And finally, like I could feel myself changing. And I knew I was really ramping up into active labor. Um, and we did a lot of movement in the bathroom and like some posterior pelvic tilt. So like really flexing my pelvis down is what finally unhooked Jayla from my pelvis where she was kind of stuck. And that's when things really started to progress. They had told me that that in like right after that, they had checked me again and like not much progress had happened, but I had felt different. And I wish I would have just stuck with that. But that's when they told me, like, your cervix is starting to get inflamed, is getting enlarged. And of course, I'm like, well, shit, that means I'm like getting closer to a C section, right? These are like the fears in your brain that are kind of talking to you. And so at that point, I had made the decision. I was also really done. I was so burnt and I had no energy left. And at that point, I was like, okay, well, maybe the one thing to save this is like I can get an epidural and I can like stop pushing and bearing down. I wasn't trying to push, but my body was pushing. And that's what was making the cervix, um, more enlarged. And so I sat for the epidural. And when you're sitting for an epidural, it's like this. You're like totally flexed and your head is down. So you're trying to open your spinal column. And when you're sitting like this and you're getting like massive contractions, I could feel something coming out of me. I also felt like I was crushing Jayla's head. And this is where some of the trauma that I initially had to get over and absolute physical trauma. So I had the most tailbone pain after birth because of like sitting in this position with her head jamming down into my tailbone. So just getting into that position for the epidural is exactly what I needed in order for Jayla to come out. But the unfortunate part is like, I wish I didn't have the epidural. So it took about 10 minutes um, because the student anesthesiologist couldn't palpate my spine. So I have very flat spinous processes or flat bones, and it's really hard to palpate, so feel them. And this newer resident or whoever he was, student, was not able to do that for me. He couldn't feel those bones. And so I had to wait for the actual anesthesiologist, the actual doctor to come in to be able to give me the epidural. And I so regret it. And I played this in my head about a million trillion times over the last year because this is where I carry the most trauma with this birth is the fact that I had an epidural. And I don't know if you can relate, but in my other two births, I had natural delivery or, unmedicated births is probably a better way to say it. I had one birth that I did have Pitocin and I really wanted to avoid that this time. But I love feeling my muscles. I love feeling my body work, even if it's uncomfortable. I can pattern it mentally as effective muscle contraction, and I don't see it or feel it as pain. So for me, I didn't want this pain to go away, but I didn't want my cervix to get any larger. And I also, I had my other two without having an epidural. And so I felt like I needed to do that for this baby too. And so that is where I carried all the trauma after this birth, the fact that I had an epidural. And now I know some people want an epidural, but I never did. And for me, I I don't like things that make it so I can't feel my muscles or can't move my legs. Like I love to move. I just love feeling my uterus contract, even though it can be classified as pain, but I don't feel it as pain. So I had a lot of healing to do around that. Also, I feel like it was a gift. I feel like this is what the universe gave me because maybe I had judgment around it. Maybe I did have judgment around epidurals. And maybe it was like, okay, you, Allison, have to experience the epidural so you can relate better to your patients, relate better to your friends, and we have plenty of patients that want epidurals, and that's totally fine and okay. But for me and my body, I did not want that. But having had this experience now, I do feel like, okay, this was like meant to be. I needed to have a birth that I could feel that. So once I had the epidural, I um like I thought she was coming out of me on the actual table. And I was just like, it was buried down. She was hitting my tailbone. And this is where I really feel like my tailbone kind of dislocated during birth because I'm sitting on my tailbone as she's descending into my pelvis. And that was not ideal, let me tell you. And so well, once they finally got the epidural, then I laid down. I remember that feeling of relief, but she was right there. She was in my pelvis. And so they gave it 20 minutes because they're like, they didn't really believe me that she was there. But then once they looked, they were like, oh, yeah, she's like right here. So I knew it was getting into that position that like finally dropped her into the pelvis. And then she was there and ready to come out once I went in onto my side. Um, and yeah, I was breathing her out for that full 20 minutes, and I was, able to like really connect to my breathing, connect to my pelvic floor. And once they finally checked me at that 20-minute mark, they're like, yep, she's here. You barely have to push. So I just got to continue my breathing. My lovely, amazing doula got to remind me of my breath. And she was like, come on, Allison, you know what to do. Like, you train people for your pelvic floor breathing. Like, you do this. So I was able to do it. And it was great. And the one thing that I do just feel so blessed for is like, even if you have an epidural, like you can still feel your muscles move and like you can still coordinate breathing your baby out as long as your muscles are flexible enough too. I also delivered Jayla inside lying, and it really taught me, this birth did, that like it doesn't actually matter what position you birth in. Yes, we try to find positions that you have the most control. But when the research is saying, like, okay, yeah, your back isn't good, or the side isn't good, or squatting is better, to me, that's all horseshit. Like, what really matters is the fact that your pelvic floor has the flexibility to open, and then you're going to have a way less susceptibility to injury when you go to push your baby out. It doesn't matter what position you do. Yeah, could gravity be nice? Sure. But, or could sideline cause more traumatic injuries? Possibly, because your pelvis isn't allowed to open all the way. But the fact is, like, if your pelvic floor has the flexibility to open, it doesn't matter what position you're pushing your baby out in or breathing your baby out in. And that was a beautiful gift to be taught. And so if you go back and listen, you'll hear, I did pelvic floor physical therapy my entire pregnancy. I worked with Dr. Riley, Dr. Victoria to really help open my pelvic floor, open my pelvis. They use the body motion protocols, the ones that I established for the clinic, and our protocols are freaking amazing. This is what everybody needs during birth. I had done pelvic floor PT before my other two pregnancies, but really it wasn't enough. Like, the way that other people do it and the way that I had done it to myself before, it was just, using electrodes and trying to open my pelvis externally and using biofeedback as electrodes. So you put these little electrodes on your perineum to see if you're relaxing or contracting or bulging. And the fact is, like, that does not tell you how flexible the muscle is, not even in the slightest. I had also done some Kegels before, and Kegels is not an effective way to train for birth, that is for sure, because that's just shortening the muscle, and we want to train for lengthening and opening the muscle. And if there's one thing that I can just like tell anyone who's pregnant, it's like, do pelvic floor physical therapy with an expert who has birth prep protocols that is going to help you open your pelvis on the inside and the outside, in order to truly allow that baby to descend through the birth canal. And so I feel really grateful for my experience at this point. I had a lot of trauma around having the epidural and not having my home birth. But at the end of the day, it's been a gift. I get to learn from these experiences. I had to adapt, if there's one thing my business has taught me, like, you can have a plan and shit can happen like COVID, and you have to make a new plan, or, just keep on keeping on. And so I feel really grateful for this experience. I'm happy to share my story. I feel like there's healing in me sharing it. I wrote it out today before I shared this verbally, because it's easier to organize my thoughts that way. And in this blog, I do share, some of those initial things I had wrote, and I will share some with you right now. I'm going to just scroll to them, because, this is my mindset postpartum, and I really struggled. I remember just like bawling to my midwife about, like, feeling like I had failed essentially. So I wrote some stuff. My labor and birth taught me a lot. And this was the immediate lesson that I learned, that I wrote down right after my birth. I said, the work I have to do is adapting to the unexpected and moving graciously to the next step. Win or learn. Learning is where true growth happens. I really was holding on so tightly to my ideal outcome this whole time and struggled to surrender to the process. I just want to do it over with this birth. But sometimes in life, you don't get to do that. I continued to write after my birth because I was really sad it didn't go how I expected. Oh, I just lost my place. So I'm going to scroll back down. Okay, I'm going to start again. I continued to write right after my birth because I was really sad it didn't go how I expected it to. And most of all, I could not fathom that I let someone put a needle in my spine and couldn't feel my muscles. I pride myself on being strong and having unmedicated births, and I love the feeling in my muscles. So to be numbed, I felt like I missed the entirety of that feeling of relief after birth, that magic that sends that feeling after this birth. And then I continued to write, and this was right after the birth. I said, "Oh man, there's no scrolling allowed on this computer." Okay. I can reiterate, I'm so sad. I can't stop mourning and replaying this experience in my head. You have a plan and it can all go to shit. How will you respond? I can't forget myself. I'm in my darkest place I have ever been. I absolutely hate the fucking fact that I succumbed to pain that was temporary and lost faith in my body and got an epidural. I cheated myself. I cheated my daughter. I cheated my family. I'm literally heartbroken. And so, of course, that's like some dark stuff, right? And this is the trauma I'm talking about. That was so real. And that was it was hard to cope with. And I didn't even want to tell people my birth story because I was so I had shared all my birth manifestations and then it didn't go like that. And so, that was truly how I'm feeling, how I was feeling. Now I've come a long, long way to heal after that. And I really wanted to share this because I think it's important. People were along my journey during my pregnancy and I never really fully shared the birth story. I shared that it was a vaginal delivery and I had very little pelvic floor trauma because I had prepped my pelvic floor. But there was a lot more emotion wrapped up into the mourning of not being able to like have the baby where I wanted, not being able to have the home birth. Um, yeah. And so sharing it gives me it's a little bit of a release and, coping to the trauma. And I don't have another baby that I'm going to have that I get to do a redemption birth with, right? Like this was going to be my amazing birth story, home birth story. And it wasn't that. And so that is hard to cope with. But I hope me sharing this inspires you to heal from your own births mentally and physically. And if there's one thing that healing physically in pelvic floor physical therapy, I had to heal my tailbone, and man, was that very sensitive and released tons of trauma when I started pelvic floor therapy after birth again. And, I didn't have as much tissue trauma, but my tailbone was, essentially dislocated, it felt like, or very bruised. And so, I had to heal that still. And my body's come a long way. My prolapse was never terrible or that affected because of the fact that my pelvic floor was so prepped for birth. So I hope you find this empowering. I hope that this either helps you and inspires you to prep your pelvic floor for pregnancy and birth, and or heal postpartum. So let me know what you think. Let me know if you have questions. And I am sending you love and healing no matter how you birth your babies. All right. Take care, guys.